In August 2011, Tanya Monsall, a 26-year-old mother of two, was battling pneumonia and HIV from a hospital bed in New Plymouth, New Zealand. One Tuesday morning, while admitted into the hospital, Tanya's two children were turned away from her bedside because they were outside at the 2 p.m. to 8 p.m. visiting time slot. Tanya said that the hospital's refusal came as a shock, and her precious time with her terminally ill son is being cut short because of a crackdown on hospital visiting hours. She stated that, "At the moment I'm living in fear, that I'm going to die or my son is, and they're taking away my support, which is causing me stress." Among a society driven by patient-centered healthcare, it is often overlooked that many hospitals implement limitations, especially to patient visitation hours. With the importance that family and visitors can have on the patient's overall health and well-being, hospitals should have no limits on visitation hours. Restrictions on visiting patients in the hospital have varied widely over the past 3 centuries, from open policies to more restricted ones. In 1767, the first regulations were introduced at St. Bartholomew's Hospital, which allowed visits up to 1 hour a day, and in the 1870s, the Royal Berkshire Hospital allowed only 15 minutes of visiting twice a week. In 1832, visiting hours became restricted because of epidemics of infection, closing all wards to visitors during a national cholera epidemic, and later in 1883 to the measles and smallpox outbreaks. In 1894, St. Bartholomew's Hospital introduced the use of visiting cards, which was a means of restricting the number of visitors by providing a certain number of cards per patient that was returned once the visitor left the room. In 1948, many hospitals had stringent visiting policies. However, the impetus for change was the plate record in 1959, which outlined the case for opening visiting hours to children's wards to improve the emotional and overall mental health of the children to prevent isolation from the family. In the 1980s and 1990s, many hospitals started restricting visiting hours again as a response to nursing staff, concerned that disruption by and demands of visitors could interfere with the running of wards, hamper patient care and privacy, and stress levels of patients. Standard restrictions currently include 2 visitors per patient having afternoon and early evening visits only. Many hospitals in California have typical hospitals visiting hours ranging from 8 a.m. to 8 p.m., with exceptions for each hospital, unit, or facility based on their own hospital policy and administration. The survey in 2005 during an open visiting policy found that patients and visitors appreciated flexibility of hours but preferred a quiet hour with no visiting and uninterrupted meal times. Unlimited visitation hours cause less anxiety and stress on patients and family members during the hospitalization. According to Dr. Donald Berwick from the Institute of Healthcare Improvement, restricting visiting in ICUs is neither caring, compassionate, nor necessary. They write that the presence of family and friends tends to reassure and soothe the patient, providing sensory organization in an overstimulated environment and familiarity in unfamiliar surroundings. Berwick also pointed out that visits from family and friends do not usually increase patient stress levels, as measured by blood pressure, heart rate, and intracranial pressure, but may in fact lower them. Patients' heart rates and the frequency of premature atrial and ventricle contractions were measured before visitors arrived, 5 minutes into their visit, and after they left. No significant differences in the rates were found between the 2 groups. Mesner explained that the reduction of anxiety and stress for the patients and family members results in better recovery during the patient's hospitalization. Unlimited visitation hours allow family members to become more involved in patient care. According to a study conducted by Roland, published in the Journal of Nursing Care Quality, a major concern expressed by 95% of respondents was the desire to be able to perform personal care for their loved ones. Allowing the family members to become more involved in patient care and activities of daily living, the patient may feel more comfortable. According to Philip Cook, an ICU clinical manager for St. Francis Hospital, Having the family at bedside can promote healing. It can help the family be a part of the team of caregivers. Unlimited visitation hours allow for open communication between patients, nurses, doctors, and family members. According to Berwick, the family serves as a helpful support structure and provides increasing opportunities for patient and family education and facilitating communication between patient and clinicians, and being able to provide feedback to nurses and physicians more effectively than the critically ill patient. John Hefner, MD, a medical doctor at the Medical University of South Carolina, felt that allowing family members to be present while on patient rounds to be of value. Hefner declares, "You have family members see the care and concern we apply to the patient's care. The family is an added resource of information, and new questions come up when we see the family earlier." Some experts believe that unlimited visiting hours may create more problems instead of provide benefits to patient care. Sue Hartley claims that unlimited visiting hours spread infection. She believes that the spread of infection is easiest in places where groups of people are together for reasonable amounts of time, such as hospitals. For that reason, I would urge anyone thinking of visiting friends or family in the manner to stay away until we can be sure the virus is no longer spreading. However, she fails to take into account that with infection control and proper education to family members and visitors, it will prevent the spread of infection. Muley argues that the use of the hospital's infection prevention and control to guide the practices and visitation hours can encourage visitors of all ages to wash their hands before and after patient contact, which provides the opportunity for patient and family education. Others believe that unlimited visiting hours cause more work for hospital staff, including nurses and physicians. In hospital restrictions justified, retired nurse Linda McDonald claims that all hospital staff, from cleaners to nurses and doctors, are overworked to the point of exhaustion. If restricting visitors means that the staff can carry out their duties in a less hurried and more conscientious manner, public should support them. However, unlimited visiting hours allows family members to help with the workload of the healthcare providers by assisting in patient care throughout the shift. Hefner argues that medical technology has made open visitation policies more possible. He reveals, "Nurses used to be mixing medications, putting in IV bags, making careful calculations. They were more easily disturbed. I can see where a family member in that circumstance could be more distracting." In conclusion, the benefits of unlimited hospital visiting hours provide better patient care and outcome. With such benefits including less anxiety and stress for the patients and family members, allowing family members to be involved in patient care, and allowing open communication lines between patients, family members, and hospital staff, the patient will be better satisfied with the care they received in the hospital. Here are some of my references. Thank you. Are there any questions?